Diabetes Care and Education Specialist with the Good Shepherd Diabetes and Nutrition Center. And today we're going to do a topic on diabetes and inflammation. So I'm going to get these PowerPoint slides here for you. So our talk today again is on diabetes and inflammation and the role it plays in heart disease. So inflammation can be a good thing or it can be a not so great thing. So inflammation that's kind of acute or short-term inflammation when you get an injury and something's swollen or inflamed, and it is a sign of healing and can be good. It's short-term inflammation. What we're talking about with diabetes and inflammation is more of a chronic, long-term inflammation. So chronic inflammation is an inflammation that you can't really see or feel that is happening internally in the body, and that's when we get issues with chronic disease. So chronic inflammation affects all of the tissues of the body. It can affect all of your potential for chronic diseases. So heart disease, diabetes, cancer, all these things listed on the slide are affected by chronic inflammation. And so that's what we want to address in reducing our risk of chronic disease and complications from chronic disease. And we're going to talk today a little bit more about how you reduce that inflammation through food and how that impacts diabetes. But chronic inflammation is what we're referring to today when we go through our talk and we talk about inflammation and why it's not a good thing for the body to have and how it affects blood sugar and heart disease when you have diabetes. So in order to talk more about blood sugar and inflammation, we kind of need to talk about the role and how blood sugar is regulated in the body. So insulin is that hormone that the body makes that helps get the sugar out of the blood and into the cells where your body can use it for all its different metabolic processes. When you have inflammation in the body, and again that chronic inflammation that we kind of referred to, the body isn't able to use that insulin well, and you have what's called insulin resistance. So insulin resistance is really what's driving diabetes and high blood sugar. So we want to address inflammation in order to help the body use that insulin a little bit better, make the body a little bit more sensitive to insulin. When you have insulin resistance, that's when you have prediabetes or type 2 diabetes, heart disease, obesity. All of those chronic conditions are associated with insulin resistance. Most often, we think about insulin resistance, we think about type 2 diabetes. But anyone who has type 2 diabetes likely had insulin resistance for quite some time before ever being diagnosed with type 2 diabetes. Insulin resistance really drives many different chronic conditions, and you can't see or feel insulin resistance in the same way that you can't see or feel that chronic inflammation. And so knowing that you have insulin resistance is nearly impossible. There's no signs or symptoms, but someone who has heart disease, prediabetes or diabetes, high cholesterol, high blood pressure, insulin resistance is definitely a driver in that. So even if you don't have diabetes or you haven't been diagnosed with prediabetes, but you have heart issues or high cholesterol or high blood pressure, you most likely have some version or some degree of insulin resistance going on in your body. And it's important to then address that insulin resistance in order to decrease your risk of developing any future complications or additional chronic conditions that are related to that insulin resistance. And the biggest thing that we can do that we're going to talk about today is about how you make those changes through food in order to help decrease that inflammation in the body and then address that insulin resistance and make your body a little bit more sensitive to the insulin. So again, it's important even if you don't have high blood sugar at this point, if you don't have diabetes, but you have some sort of insulin resistance going on in the body, such as having high cholesterol or heart issues or high blood pressure, addressing that insulin resistance to prevent yourself from getting prediabetes or diabetes in the future. And so that's what we want to talk about today is if you have insulin resistance and diagnosed type 2 diabetes, we want to treat that. But even if you have other signs of insulin resistance, preventing the potential for future diabetes and any complications that could come with that if you don't control the blood sugar. So again, reducing inflammation and insulin resistance is that key to preventing chronic diseases like heart disease and diabetes. And food is plays a huge role in that, and so that's what we want to spend the rest of today talking about is how you go about helping to reduce that inflammation through a healthy diet. So one of the things that you often hear people say is everything in moderation. And while that's somewhat true, you don't necessarily want to be eating moderate amounts of vegetables and moderate amounts of desserts, right? You don't want to eat a moderate amount of everything, but you should be eating a lot of vegetables and a small amount of desserts, right? There's no special diet or foods that are completely off limits, but it's more about eating high amounts of, vegetables and fruits and other healthy foods and small amounts of desserts rather than that kind of moderation in everything, because that's kind of where you're going to have a diet that leads to more inflammation rather than a diet that leads to less inflammation. So when we're talking about foods that feed inflammation, one of the biggest things we're talking about is sugar. So we're going to go into that in a little bit more detail, but this slide kind of shows you all of the different foods that feed inflammation. So sugar being a huge impact on that. Fast food, fried foods, definitely going to have a huge impact on inflammation in the body. Refined grains, so we're talking there about white bread, white rice, kind of more of those refined grains, and of course the processed foods, anything that's boxed or frozen or kind of shelf stable foods that are a little bit more processed often have added sugar, which is then part of why they feed inflammation in addition to some of the other food additives that they have. Excessive alcohol, excessive red meat, again, are linked to more inflammation and increased risks of chronic disease. So these are all foods that we really want to try and limit in the diet and eat other foods to replace them, rather than having a diet high in these types of foods, because this is going to be a very pro-inflammatory diet and cause a lot more issues with inflammation and aches and pains and risks for chronic disease. So we're going to talk a little bit about sugar. Many of us know that sugar is found in candies and cookies and cakes and those types of things. That is a big source of sugar in our diet, but sugary beverages is another large source. And oftentimes we think about sugary beverages being soda, and soda is a main source of a sugary beverage that we really want to eliminate from the diet. But all of these other drinks on here, so energy drinks, fruit juice, Gatorade, all of those things are also sugary beverages. Now, things like 100% fruit juice aren't necessarily sweetened beverages or sugar added beverages, but they do have a lot of naturally occurring sugar that came from the fruit. But for example, in this orange juice, there's 41 grams of sugar because there's more than one orange worth of juice. So an average orange would only have about 15 grams of sugar. But when you make juice, you're kind of concentrating that sugar. So while it's not a sugar added beverage, it is a sugary beverage and is going to contribute to your sugar intake. Whereas the other things like vitamin water and Gatorade and soda have sugar added to them. So sugary beverages are definitely one of the things that you want to try the most to eliminate from your diet and replace with sugar-free beverages, especially water or unsweetened tea, unsweetened coffee can be good alternatives. But trying to make sure all of your beverages have no sugar added is going to be huge to reducing your sugar intake and helping to decrease inflammation. There's many other foods that have a lot of sugar. We talked about cakes and cookies and candies and sweets and things like that, but sometimes there's other foods with those hidden sources of sugar. So for example, yogurt can be a very healthy food, but you want to have a plain yogurt that you add your own fruit to versus buying a fruit that's already flavored like a peach or a strawberry flavored yogurt, because there is a ton of sugar in those and not a lot of peach or strawberry or whatever the fruit flavor is. And so they end up being a very sugar-filled food, whereas if you got a plain yogurt or a plain Greek yogurt and then added your own fruit, you're going to get much less sugar from that yogurt than a pre-flavored yogurt. In the example, with toast and coffee and juice, there's obviously sugar in the beverages, but sometimes the things you add like jams or syrups or honey or other condiments that you use, fast food has a lot of sugar added to it. A lot of shelf-stable, boxed, pre-done foods, cereals and oatmeal and those types of things have a lot of sugar added that you don't necessarily know is there because you know it's a sweet food, but you don't know how much sugar they've actually added, versus if you buy the plain versions and add your own sugar, you can control how much sugar is added to those foods. So you really want to be cautious about foods that have those hidden added sugars and trying to find unsweetened, plain foods that then you can either sweeten or add fruits or other things to help get the flavor you're looking for without all the extra sugar that would come in the processed version. And so getting rid of that sugar is really going to go a long way to help reducing inflammation in the body. So again, these are just more examples of foods that do have a lot of sugar, even though they don't taste sweet. So instant oatmeal, replacing that with a plain oatmeal and adding your own fruit. Getting real broccoli and adding cheese instead of getting a pre-sauced food. So really trying to go back to more whole foods that then you cook yourself, or you can still add flavors and fruits and things too, but that you're not getting the packaged foods that are shelf-stable, that have a lot of sugar added to them, in addition to other ingredients to make them shelf-stable that also promotes inflammation. Doesn't mean you can't ever have these things. Sometimes we have these things in our pantries for, necessity or quick on-the-go things, but really trying to limit them and have them very, sparingly and doing more real food to replace them. The other thing we want to talk about is carbohydrates. So carbohydrates are what cause the blood sugar to go up. And we need some carbohydrates in our diet, but we want them from healthy sources. So the foods that have carbohydrates are going to be your grains, so bread, rice, pasta, a few starchy vegetables, so corn, peas, and potatoes. Beans and lentils have carbohydrate, but again, a very healthy source. You've got fruits and milk and sweets. All those things have carbohydrates, which are going to cause your blood sugar to go up. But when you're choosing carbohydrates as part of your diet, you want to try and keep those portions lower. So trying to keep it to about 3 servings or less per meal, where a serving is about a half a cup. So you're looking at about a cup to a cup and a half per meal of these carbohydrate foods, and trying to choose them from healthy sources. Fruits, beans, lentils, quinoa, whole grains, sweet potatoes. If you have other grain, oatmeal versus, like a cereal, milk and yogurt, as long as it's a plain yogurt, then you're adding things to rather than a sweetened yogurt. So carbohydrates can be included in a healthy diet and should be, but from those healthy sources where you're also getting fiber and nutrients and other things besides just a refined carbohydrate that has a lot of sugar added to it. So again, trying to choose those carbohydrates from healthy sources, but also limiting it in your meal to a small amount of servings, so that 3 servings or less per meal for most people is a good average. And then you can round out your meal with vegetables and proteins and other things instead of adding more carbohydrates. So we know sugar causes a lot of inflammation, but what foods fight inflammation? So looking at all the things that you can add to your diet that are going to really promote reducing that inflammation. So fruits and vegetables, healthy fats, herbs and spices, those are all things that we want to be the bulk of our diet, right? Especially vegetables. You always want to have more vegetables than fruit, simply because fruit does have natural sugar, and while it does have natural sugar and fiber and many nutrients, you still want to have more vegetables than fruit for that reason of that sugar. Healthy fats and herbs and spices are going to be great things to add to your diet. So we're going to go through some of those and what is a healthy fat here in a little bit. Vegetables is, again, the best thing you can do to round out your meals. You always want to have a half a plate of vegetables with most of your, all of your meals if possible. They're going to give you lots of fiber and nutrients. They're going to fill you up. They're not going to have any sugar or fat or carbohydrates, or very low carbohydrates, but mostly fiber. So it's a great choice. You want to try and have at least 2 servings at every meal. That's a cup of vegetables. So again, a serving is a half a cup. So trying to remember to get a cup of vegetables sometimes seems a little bit easier than trying to think about 2 servings. So looking at least a cup of vegetables with all your meals, and from a variety of different colors. The colors in the vegetables provide the nutrition. So making sure you get reds and yellows and purples and all the different colors of the rainbow for your vegetables to not only provide the nutrients and fill you up, but also kind of make it so that you don't have to eat as many carbohydrates and processed foods at your meals. The other thing we want to talk about is fats and making sure that we include those healthy fats. So fat is not necessarily a bad thing, very similar to carbohydrates and other foods. It's about the type of fat. And so if you're getting your fat from processed foods and fried foods and packaged foods, those are the fats we definitely want to decrease because they're the not so healthy fats. But you do want to include fats from healthy sources. Fats from healthy sources such as fish, avocado, nuts, olives, olive oil, avocado oil. Those fats are actually anti-inflammatory. They have those omega-3 fats that you might have heard of that are really good for heart health and reducing inflammation. And they come from whole natural foods. And so we want those fats in our diet each day to help with weight loss and insulin resistance and reducing inflammation, and just have an overall healthy diet where we're getting all the nutrients that we need. Plus, they're going to give you that long-lasting energy and help fill you up so that you're not as hungry between meals and you don't feel that need to add in more of those carbohydrates or sugary snacks or those types of things. So trying to get a small serving of healthy fats every day, or even a little bit at each meal, is a great thing. So even just sprinkling a few nuts on top of a salad or having some avocado on a sandwich, getting those small portions of those healthy fats with every meal is going to be really good for that purpose. Like we mentioned, getting color is key from all those fruits and vegetables, for getting all the micronutrients, so phytochemicals and antioxidants and vitamins and minerals. These all play a really important process in metabolism, which having all of the nutrients that you need to have a healthy metabolism is really going to help to reduce inflammation. And so making sure that you're not just eating green vegetables. You want to eat a lot of green leafy vegetables. That should be the bulk of many of your vegetables, but you do also want to have all of the different colors in order to get all of the nutrients that you need for your body to function properly and help reduce that inflammation, keep that insulin resistance down, manage blood sugar and other chronic diseases. The other thing that's going to be really anti-inflammatory is going to be herbs and spices. Not only is this going to help give a lot of flavor to your food, it's going to also help you to reduce the use of salt, which is good in general for nutrition. So herbs and spices kind of serve a dual purpose in flavoring food without the use of salt, but also adding a lot of anti-inflammatory properties. So herbs and spices have a lot of those phytonutrients or that we talked about on the last slide, and they're an easy way to add vibrant colors and flavors to your meals and also get that benefit of some of those anti-inflammatory compounds. So just about any herb or spice that you can think of is going to be a great choice. There's no wrong choice when you're flavoring food. Sometimes that's what gets people away from trying different herbs and spices, is not knowing what foods to pair them with. But try different combinations and find the ones that you like, because anything you can do to use ginger or garlic or turmeric or cinnamon or basil or rosemary, all of those things are going to add great anti-inflammatory compounds to your food for great nutritional value, but also great flavor, so the food tastes good and you enjoy eating those foods as well. So experiment with different herbs and spice blends and find the ones that you like and can flavor your foods with to get those great compounds. When we're talking about protein, protein is essential, right? Protein's not necessarily inflammatory or anti-inflammatory. It's an important part of a well-balanced diet, but the portion size matters again. We don't want excess protein. Excess protein is when we start to have more of a pro-inflammatory diet and not so much of an anti-inflammatory diet. And the type of protein matters, right? So we talked on that first slide about how red meat is a little bit more pro-inflammatory versus if you have chicken or fish or some of those plant-based proteins like beans and lentils and nuts and seeds that are going to be a little bit better than a red meat. So you want to have protein. Our body needs protein for enzymes and hormones, but you want to try and choose healthier sources and leaner sources and some plant-based sources more often to prevent getting an excess of protein and an excess of red meat protein, especially if it's fried or anything like that. You want to definitely choose meats that have been grilled or baked to not only get healthy protein, but also reduce some of those unhealthy fats and increase the healthy fats instead. All right, so as a review, we don't want to eat foods that are going to cause inflammation, right? So in order to prevent inflammation, we want to really eliminate sugary sweetened beverages. We want to limit how many desserts and sweets we have. It doesn't mean you can't have any ever, but we want to make sure that we're reducing those and really using them as treats in small portions rather than having them on a regular basis or having them in large portions. We don't want to have too many processed or fried foods or foods that are prepackaged or shelf-stable or in a box. You know, again, that example of that instant oatmeal, which is going to be lower in fiber and have a lot more sugar than if you got a regular old-fashioned oatmeal or steel-cut oatmeal and cooked it and then added your own flavors. Even if you end up adding a tiny amount, like a teaspoon or less of honey to get some sweetness, that's far less sugar than would be in the instant pre-flavored version. Plus you're getting more fiber from the old-fashioned or steel-cut oats, so kind of all around a little bit better. Avoiding excessive grains, so not eating too much rice or too much pasta or too much bread, but having them in small portions, remembering that 3 servings or less per meal, but really avoiding those refined grains. So when you do choose grains, choose whole wheat or whole grain bread, brown rice, and those types of things rather than the white versions or the more refined versions. Really avoiding trans fats. We didn't touch too much on trans fats, but those are the fats that are in those processed foods that aren't going to be those healthy sources. So if you're really limiting processed, shelf-stable foods, you're going to be reducing your trans fats. Not too many vegetable oils, right? So again, vegetable oil isn't a bad food, so canola oil or vegetable oil isn't a terrible choice, but sometimes we get too much of it. So just trying to reduce the vegetable oils that you use and try using olive oil or avocado oil or some of those oils where you can to kind of get a better balance and not have too many vegetable oils. Most of our vegetable oil intake comes from processed foods. Same with saturated fats. So saturated fat from healthy whole foods like eggs or chicken or fish in moderate portions isn't too bad, but getting a lot of saturated fat from processed foods is going to be something that contributes a lot to diabetes and insulin resistance and heart issues. And so again, reducing the saturated fat and the vegetable oils and trans fats by really reducing those processed foods is going to be one step that you can use to kind of eliminate all of those things or reduce all of those things. And instead, replacing it with much more fruits and vegetables, whole grains, nuts, seeds, more plant-based foods. So eliminating that sugar, getting all the colors of fruits and vegetables, using those herbs and spices for flavor, adding some of those healthy fats, so nuts and fish and avocado, having portions of beef or chicken or seafood or eggs, but again, those small portions like the size of a deck of cards, so that you're getting in those quality sources that are baked and things like that rather than fried is going to be what you want to do. So kind of to summarize it all, it's less processed foods, more whole foods, and adding in some of those herbs and spices and healthy fats for flavor and as condiments. So the last thing I want to touch on quickly before ending today is if you do have diabetes, we do want to cover a few things, because if you're doing working on the food things as we've talked about, we also want to know what blood sugar should be. So this is just a reminder of where blood sugar should be. There's a couple of different organizations that put out blood sugar targets, but generally first thing in the morning or before you eat, you're looking for ideally less than 120, but at least less than 130. And then after you eat, you're looking at about an hour and a half to 2 hours after you first start to eat or your first bite of your meal, ideally less than 160, but at least less than 180 at that 2-hour mark. Is what we're looking at. And with food changes that we talked about throughout the presentation, you can really help in getting to that goal to get your blood sugars in control and make sure that you're managing prediabetes or diabetes or preventing yourself from getting diabetes. And just as a quick little reminder that we always like to tell anyone who's either taking insulin or checking your blood sugar is to make sure to dispose of your sharps properly. They can't go in the trash because they are a sharp object that has blood on them. So make sure you're putting them in a proper container and then disposing of that container properly, either by calling your trash company or bringing it to the Diabetes and Nutrition Center at the hospital. But we do want to make sure you're disposing of those sharps properly. All right. The other thing we want to just briefly cover is that if you have more questions or want more information on how to eat a more anti-inflammatory diet and get in more of those healthy food choices that are going to prevent insulin resistance and diabetes and help decrease that inflammation, we have a great program here at the hospital. Nutrition therapy is covered by a grant at the hospital, so your cost ends up being $4 per half hour to visit with one of our registered dietitians to get more information on healthy eating and help you come up with some healthy meal ideas. And so we have those options available. And we also have a group class that covers all of these things that we talked about today, but a little bit more in detail. So it's called the ACT program, and the program is a 9-week series of classes. I know the slide says 8 weeks, but it is a 9-week series of classes taught by our registered dietitian nutritionist. And we focus on food, a little bit on exercise, we do some cooking demos, but anyone who's looking to lose weight or lower blood pressure or cholesterol, prevent chronic conditions like diabetes or heart disease, kind of reduce that inflammation, have more energy and kind of or achieve really any health-related lifestyle nutrition type goal, this class covers all of those topics and how you achieve that through diet and healthy lifestyle. And so that class is available. It's part of the nutrition therapy grant, so it is covered at a subsidized rate. And you can call our department to get more information about when the next classes and are starting and when you can join and get that information. Or if you prefer more of a one-on-one approach, we can do that nutrition therapy appointment with one of our registered dietitians for just about any nutrition-related condition, weight management, prediabetes, food allergies, anything that you have questions about, we can help answer for you. So just if you have any questions or want any further information, feel free to give our Diabetes and Nutrition Center a call. Our phone number is there on the screen, and we'd be happy to answer any questions for you. Thank you, and we look forward to hearing from you.